Hello, welcome to this session on health assessments in non-college communities, rural and urban settings. Our speaker is Dr. Lisa Franzen-Castle, Associate Professor and Extension Nutritionist Specialist at the University of Nebraska-Lincoln. Dr. Franzen-Castle received her Ph.D. in 2009 from the University of Minnesota Twin Cities with a major in nutrition and a minor in anthropology. She's a registered dietitian and received her master's and Bachelor of Science degrees from the University of Nebraska-Lincoln. She's a professor and extension nutrition specialist with the UNL in the Department of Nutrition and Health Sciences. Additionally, she serves as the Associate Dean for Faculty Affairs in the College of Education and Human Sciences. I will be showing a video of Lisa's presentation. She is with us today, so feel free to interact with her in the chat during the presentation. And we will also have time for Q&A at the conclusion.
Hello, and thanks so much for joining this session. My name is Lisa Franzen-Castle, and I'm a professor and extension specialist in the Nutrition and Health Sciences Department at the University of Nebraska-Lincoln. I will be serving as your presenter today on the topic of health assessments in non-college communities, rural and urban settings. Throughout the presentation, I will discuss relevant information to both types of settings and specifically emphasize rural considerations where applicable. The focus for today's presentation will be on the following: community health assessment overview and definitions, common data collection methods, special considerations around data, the importance of community-based participatory research, conducting health assessments, some examples of tools and resources, options for sharing results for information dissemination, and conclude with sources and references addressed in the presentation. Health research, assessment, and evaluation are all processes that seek to improve the health of populations through better understanding. These three activities often overlap, can share similar methods, and may be defined differently. For the purpose of this presentation, they are defined as the following: research seeks to discover new knowledge or test ways of knowing through investigation. It seeks to answer specific research questions, meet stated research aims or objectives, or test a theory or hypothesis. Needs assessments seek to measure or assess the circumstances present in a specific community, organization, or program. Assessment can be used to identify needs or gaps in available health services, as well as assets and strengths. The needs assessment piece will be a primary focus of this presentation. Program evaluation focuses on determining how well a program or service is doing in terms of meeting specific goals and objectives. Ideally, the goals and objectives were identified prior to implementation of the program, or at a minimum prior to knowing the program results. The focus of program evaluation is to inform decisions about how to improve the delivery and impact of a program. And the subject of evaluation is decided based on the program stakeholders' values. Conducting a community health needs assessment can help programs determine where and how to use limited resources to address health-related needs. A community health needs assessment can serve as a starting point to address a community's needs. The assessment identifies and measures factors that impact health, which were referenced in the previous slide, such as gaps in services, as well as assets and strengths available to help resolve these issues. This assessment will help to identify topics and issues relevant to a community. And data for determining community needs can be collected directly, which will be covered on the next slide, or through secondary data sources, such as demographic data, vital statistics, hospital records, morbidity and mortality reports, and literature reviews can also provide valuable information. Community health needs assessment data can be collected from a variety of sources, and some examples include the Chamber of Commerce, civic organizations, community college or local university data, Employment Security Commission, faith-based groups, health departments, hospitals and healthcare providers, large employers, law enforcement agencies, libraries, nonprofit organizations, as well as the public school system. So now we're going to talk about some common data collection methods. Many methods are available to gather evidence, and selecting the appropriate methods will depend on the questions you have in mind, the resources and expertise available, and the time and geographic constraints. While this is not a complete list, it covers some of the more common tools used. Surveys use sets of questions which can be asked in person, by phone, or on paper or online. These questions can be targeted to an individual, such as a community resident or healthcare professional, or an institution, A survey or questionnaire might be used by itself for point-in-time information or might be targeted to before and after an intervention to see if there is a change in circumstance. Interviews are discussions between an interviewer and another person who may represent themselves individually or may be representing an institution. A key informant interview, for example, is used to find out in-depth information about a community or organization by asking a stakeholder for their insights. Focus groups are group interviews where a facilitator leads a gathering of participants, all of whom share some common characteristics, such as they may live in the same community or belong to a similar stakeholder group. And because of the interactions among the participants, it may offer richer insights that would not be obtained individually. Observation involves an investigator watching participants do something that is of interest. For example, a study might observe how healthcare workers interact with a telemedicine program in providing care to patients. Secondary data can be taken from existing data sources. For example, a needs assessment might draw on data collected by various state and federal sources. Indicators are measurable information showing the condition or existence of something. Indicators are especially useful in evaluation because they are typically trusted by administrators or program staff to inform decisions. And care should be taken in selecting indicators because some may be very time-consuming or expensive to collect. And the SNAP-Ed evaluation framework and interpretive guide is a fantastic tool that is specifically for SNAP-Ed programs, but it's available publicly for anybody to use. All SNAP-Ed programs use 51 indicators to measure the success of their programs. That's the amount that's available, and SNAP-Ed programs select the ones that make the most sense for them. For each indicator, the evaluation framework and interpretive guide provides details, background, research, as well as measurement instructions. And I've posted a link at the end of the presentation so you can access the guide. If you're not familiar with it, I highly encourage you to check it out. Special considerations around data. Whether you're collecting data for research, assessment, or evaluation, it's important to make sure that data is managed in a responsible manner, particularly any information that relates to an individual or family. You should communicate how you intend to maintain the privacy of participants in something like a cover letter, an information sheet, or a focus group agreement. In rural areas where people may know more about one another and where various characteristics can make it easier to identify someone, it is even more important to consider how data is handled and stored. Funders, and federal funders especially, have specific requirements and processes to protect the well-being and safety of participants. For example, studies that involve human subjects are subject to review by an institutional review board. And the purpose of an IRB is to protect the rights, well-being, and welfare of research participants. And I can't emphasize enough, if you're working with an IRB, that it's so important to communicate with them prior to submitting materials so that they have more context around the project and you can have conversations with them, address questions, and get recommendations. This can really make the process much smoother and quicker when it comes to the application process and revision requests. And now we're going to talk a little bit about community-based participatory research. The Agency for Healthcare Research and Quality defines community-based participatory research as an approach to health and environmental research meant to increase the value of studies for both researchers and the communities participating in the study. When using the CBPR approach, community members, healthcare facilities, and other relevant stakeholders work alongside researchers. This cooperation should begin as early as setting a research agenda and identifying community needs, and continue through dissemination of research findings, implementation of interventions, as well as future studies. The development of an ongoing relationship between the community and the researchers is an important piece of CBPR. It helps develop trust and participation and ensures the work undertaken is relevant to the community and that findings and interventions benefit the community, not just the researcher's academic interests. Researchers working with a specific group and/or a rural community can be perceived as outsiders. So developing an advisory board and building a presence in the community early on in the research process is very important. The involvement for stakeholders may vary throughout the process due to their interests and ability to contribute to different stages of the work. Researchers may also face challenges to community engagement depending on their research topic. It is helpful to use a CBPR approach that can adapt to the needs of a particular community partnership. The CBPR approach has the potential to better meet the research needs of rural minority populations and help address the health disparities they experience. Historically, Indigenous and other communities of color have been the subject of research, and they have not been considered active participants in the research process. As research subjects, they have experienced institutional racism, from and mistreatment by research organizations. Indigenous and other communities of color are also less represented in clinical studies, which is another barrier to identifying effective interventions to address health disparities. A 2012 Health Services Research article, a systematic review of community-based participatory research to enhance clinical trials in racial and ethnic minority groups, found the use of CBPR improved recruitment of communities of color into clinical trials and helped determine the effectiveness of interventions for these groups. American Indian communities have an interest in CBPR, and in particular, tribal participatory research, as a way to ensure research conducted will contribute to the health of American Indians and be respectful and appropriate to a community's culture, with power distributed equally between the tribal government and the researcher. TBPR, as defined in tribal participatory research mechanisms of a collaborative model, involves tribal oversight and control of the research process, a formal resolution from the tribal council identifying the goals and methods of the project, an oversight committee with tribal authority to approve or deny project activities, as well as a tribal research code that governs the research process, a facilitator for meetings between the oversight committee and researchers, community members hired and trained to work on the project, which is important to build the tribe's research capacity, and culturally specific methods that are aligned with community values. Given the long history of researchers coming into tribal communities and conducting research that did not benefit participants, American Indian communities may find CBPR useful as a way to prevent this type of encounter and to help shape research that meets their community's needs. Tribal governments and other organizations are developing infrastructure for American Indian communities to not only act as research partners with outside entities, but also to conduct their own research, including the support and development of researchers from within the community. A 2009 literature review in the Journal of Aboriginal and Indigenous Community Health covers the key principles of CBPR in the context of tribal research. This article and the TBPR article previously mentioned identify additional considerations. Recognize the historical research experiences of tribal communities and work to improve the image of research. Understand tribal sovereignty, learn about tribal membership and community membership, understand the differences among tribes, expect a long review and approval process and allow time to build trust. Be prepared to allocate a large portion of project funding to oversight and planning. Identify key tribal members such as tribal elders and tribal government representatives. Anticipate turnover in tribal leadership. Learn about and incorporate the tribe's spiritual and philosophical beliefs into the project. Consider the tribal context when interpreting the data. Obtain tribal approval for publication of study results, and recognize increased tribal capacity as a valuable outcome of the project. So when should we conduct a needs assessment and plan the program evaluation for community health projects? Needs assessments and program evaluation planning should be included at the very start of the project, as has been identified in earlier slides. Conduct a needs assessment to identify the issues to address and identify helpful resources. Select and adapt as necessary a program with goals aligned to meet the identified need and that is feasible given the available resources. Plan how you will evaluate the program and identify baseline data if they exist, and then begin implementation. It can be appealing when you hear about a successful project in another community or a set of activities that sound useful to decide that it's the right intervention to use. However, there's no guarantee the circumstances in the other community are similar enough to your own for the same intervention to work. So talking more specifically about health needs assessments, a needs assessment conducted prior to the beginning of program planning and implementation will be most effective. Understanding the current circumstances, needs, and strengths can really help program planners select and adapt an intervention that is a good match for their community. Rural communities in particular face challenges if they invest resources in a poorly targeted intervention. These could include not addressing the intended goals of the program, not being able to afford an alternative intervention if the first one is not successful, losing the confidence of community members and stakeholders, which may be difficult to renew for future projects, and losing the confidence of the project's funder, especially in an area where there are likely limited sources of funding. A program evaluation should be designed in the planning stage of a project. This will clarify the rationale for the program and how the proposed activities target the needs the program intends to address. Planning the evaluation before you begin will ensure you are measuring needs and circumstances within the direct and immediate control of the program. Many factors influence health within communities, including the individual health behaviors, community characteristics, environmental factors, accessibility of healthcare services, and the types of services delivered by government agencies or private and not-for-profit organizations. These issues faced by residents of communities are very different than those in urban areas. Rural residents may face disparities due to a disproportionate burden of chronic disease relative to the general public, restricted access to quality healthcare, insufficient or lack of health insurance or coverage, geographic isolation, lack of public transportation, poor infrastructure, low educational attainment, low health literacy, poverty and unemployment, a smaller healthcare workforce, and a lack of specialty care, limited availability of bilingual providers and interpreter services, and cultural or social differences, stigma, and norms. And although these issues may be more prevalent in rural areas, specific neighborhoods, census tracts, zip codes of urban environments may also experience these issues more prevalently. An example I wanted to share for urban considerations is that ongoing evidence shows that the community one lives in has a significant impact on their overall health. The Community Health Endowment of Lincoln, Nebraska, in collaboration with partners, created interactive maps to show how parts of the city differ in a variety of health factors and outcomes, including healthy food access, tobacco use, first trimester care, primary care, dental care, and more. Although the overall profile of Lincoln may appear positive when looking at the numbers, working with these types of mapping projects has helped identify sub-communities of interest that need additional support, resources, and programs. So now we're going to talk about what are the main steps in planning for and conducting an assessment. Communities planning to conduct an assessment will benefit from thinking about the resources available in a particular community that can support the assessment activities. They can leverage existing relationships and networks, both formal and informal, to gain support and partners in the assessment process. And these networks include a wide range of people and programs that impact health, such as faith-based, schools, law enforcement, Head Start, WIC, and many others. They can make use of the hospital or public health newsletter, local newspaper, radio station, and other media to inform and engage community members. Already scheduled local events, such as regular meetings of service organizations, or another opportunity for weaving the assessment activities into community life. While the details of an assessment will vary depending upon its purpose, the broad steps are similar. Gather the interested parties or stakeholders. Think about and network with other organizations in the community or region. Who else could benefit from the information being gathered? Who should be at the table to address the suspected issues or concerns? And who would be willing to contribute resources? As a group, define what is being assessed, what geography, what type of services, provided to whom. Identify the goals of the assessment and the purposes for which you anticipate the findings will be used. Locate sources of existing data that can answer questions suggested by the assessment goals. Gather information through focus groups, interviews, surveys, or public forums. Analyze the results, including the development of maps and other types of reports that show what has been learned. Consider including recommendations for next steps. Share the findings, and I will cover examples of this in a later slide towards the end of the presentation. And consider making the assessment a recurring activity. For example, repeating annually or every 3 to 5 years rather than a one-time task. And speaking of annual and or every 3 to 5 years, there are requirements for hospitals to conduct community health needs assessments. And so the Internal Revenue Service Bulletin for nonprofit hospitals includes a requirement to conduct a community needs assessment and adopt an implementation strategy to meet the community health needs identified through the assessment at least once every 3 years. On an annual basis, nonprofit hospitals must provide a description of the actions taken during that taxable year to address the needs. The implementation strategy should seek to address the needs identified in the assessment. And setting forth how it plans to address identified needs, a hospital should explain what actions it will take and the anticipated impact of the actions, identify the programs and resources it plans to commit, and describe any planned collaboration between the hospital and other facilities or organizations. Additionally, there are community needs assessment requirements for public health agencies related to the Public Health Accreditation Board accreditation standards. One of the prerequisites for public health agencies interested in pursuing accreditation is the completion of a community health assessment and a community health improvement plan, as explained in the 2019 Guide to National Public Health Department Initial Accreditation Guide form. There is also another guide that includes details on the CHA and CHIP requirements, similar to the CHNA requirements. The CHIP should address the findings from the CHA. So given that we know there are some requirements by different entities, how can we work together to conduct community assessments? The IRS requirements of nonprofit hospitals are similar to the requirements that local public health agencies must meet to pursue accreditation. In rural communities, the stakeholder groups for each assessment overlap and the financial resources to undertake a study are limited. So it makes sense for hospitals and public health agencies to work together along with other relevant organizations, institutions, and entities. There are a number of reasons for working together on health needs assessments, and some of them include geographic service areas of hospitals and public health agencies may overlap, each organization's influence with different groups of stakeholders, sharing staff expertise and in-kind resources, similar missions and responsibility to community health, commitment to collaborate on similar activities, and more likely to have institutional flexibility and a history of working together. Other benefits of working together to assess community health and plans for improvement include a need to build shared ownership of community health, addressing differences in the service areas of the hospital and public health agency, the benefit of collaborating in data collection, which can be resource intensive, the roles and involvement of the hospital, public health, and stakeholders in setting and addressing priorities, collaboration in evaluating community benefit program results, with hospitals potentially benefiting from the evaluation expertise of public health staff and other entities, and jointly sharing findings and progress on improvement plans with the community. So I wanted to briefly touch on the different purposes that evaluation can serve. Program evaluations can serve many purposes, all with the goal of continuously improving programs to ensure resources invested in the program and in future programs are well spent. Key purposes include process improvement. Process improvement goes by many names, including process evaluation and formative evaluation. Evaluating the processes and activities are critical to understand if a program is implemented as intended. If it isn't, then there is less chance the program will be effective in meeting its goals and objectives and achieving program outcomes. Each step of how the program is supposed to be delivered should be written down. The evaluation then monitors whether each step happened as planned, and if not, provides suggestions for improvement. Rural communities in particular often must adapt programs that have not been implemented in a rural area. Evaluating these implementation processes can help fine-tune those adaptations for the rural setting. Accountability. A funder often has some minimal data they would like the program to track, such as the number and type of participants, the number and type of activities being conducted. This information doesn't say whether the program is being delivered according to plan or is having its intended impact, but it does give the funder a general sense of whether the things they expect to be done are actually being accomplished. Impact or effectiveness evaluation. Outcome evaluation focuses on the results the program achieved. The results of an outcome evaluation will help determine what difference the program makes in the long term and its impact. The information gathered can help an organization decide whether it's worthwhile to keep offering the program and help funders decide whether to support the program. The impact of a program will also determine whether other communities are likely to want to try a similar intervention. And so now I wanted to take a few minutes to talk about some community assessment examples. The first one is a handbook for participatory community assessments experiences from Alameda County. This handbook describes the process that the county health department in California took to conduct community assessments with the active participation of 2 neighborhood groups. It includes information about how to develop partners, choose data collection methods, and collect data and share the results. The next example is the community toolbox. And chapter 3 of this toolbox specifically focuses on assessing community needs and resources. So this chapter of the community toolbox from the University of Kansas Work Group for Community Health and Development contains 24 sections, covering topics such as different methods for collecting information, how to use the data collected to identify community needs, as well as resources. The next one, conducting a community health assessment. This website provides access to tools for identifying and selecting indicators for community health assessment, data collection, analysis, examples, as well as presenting findings. And this comes from the National Association of County and City Health Officials. County health rankings and roadmaps. This measures the health of nearly all counties in the U.S. and ranks them within their states. It can be used to better understand community health in comparison to other communities, and rankings are calculated using a variety of county-level measures collected from national and state data sources, and this comes from the Robert Wood Johnson Foundation. Some specific examples I came across related to urban projects. The first example is the Public Health Aspects Assessment Tool for Urban Projects according to the Urban Health Approach. As part of the CCM 2017 project titled Urban Health, this paper describes the experience of developing and testing a multi-criteria, quali-quantitative assessment framework for public health aspects. The tool aims to evaluate urban transformation and regeneration actions according to urban health strategies. The next one is called Community-Based Needs Assessment in an Urban Area, a Participatory Action Research Project. This study employed a participation and empowerment plan in order to conduct community assessment, and talks about how the participatory action research is an effective method for community assessments, and that researchers must rigorously embrace principles of mutual cooperation, respect for public ideas, and a robust belief in community empowerment in order to pave the way for responsible and active citizen participation in the various stages of research. The final example is a Healthy City Assessments, reviewing assessment tools for healthy cities. This paper 1 maps existing assessment tools related to urban design and health. 2 examines which health-related outcomes are incorporated, and 3 proposed criteria for an assessment tool for healthy cities. And I also wanted to spend a little bit of time just talking about dissemination options and sharing results. How and when you share your results can vary, and there are some factors to consider. So where your target audience typically seeks information, how quickly you hope to get your results out, and the same project may be shared more than once in order to take advantage of the benefits of different formats as the research project unfolds. So some examples include reports to the funder and or stakeholder organizations, white papers, policy briefs, infographics, and other documents published directly by an organization, media releases and interviews, social media, conference presentations and posters, as well as peer-reviewed journal articles. And I also wanted to spend just a little bit of time talking about the sources and references. So many of the information, general overview information, came from the Rural Health Info Hub. And although the focus is on rural, there is a lot of information that also applies to urban settings too. So that was really important to highlight those resources. There's also the SNAP-Ed Toolkit. There's a data considerations toolkit. There's also more information about the tribal participatory research. And there's also community health needs assessments for charitable hospital organizations. So this concludes the presentation. Thank you so much for your time and attention, and I hope you enjoyed the presentation.
Thank you, Lisa. That was a great presentation. And now we have time for questions. If anyone has any questions, or Lisa, if you would like to say any final words. You are still muted, Lisa.
Yeah, it doesn't look like we have any questions, but yeah.
Okay, well, the last round of research tool presentations will begin at 4:40. Join us back on the main room by clicking the black box in the upper right corner of the screen once we end this presentation, and enjoy the rest of the conference. Thank you.